Hello, and thank you for joining the POCUS Certification Academy, Lung POCUS course and certification information session. My name is Tiffany, and I will be your moderator today. The info session is now beginning, so all lines have been muted. Please use the Q&A box for any questions or the chat box for comments throughout today's session. Let me start by sharing what you can expect from today's session. We will walk you through our brand new Lung POCUS course and lung certification program, explain what each offering entails, and help you determine which path is right for you. You will hear directly from the team behind these programs, and we will leave room at the end for your questions. I'm excited to introduce our speakers. Daria Valenzevic, Global Learning Program Manager. Lori Goebel-Rise, Global Manager of POCUS Assessments, and Vic Rao, Global Clinical Content Manager. For those who are new to our community, I would like to take a moment to share the mission and vision of the POCUS Certification Academy. Our vision is to ensure the highest standards in point-of-care ultrasound across global healthcare and patient safety. Our mission is to validate clinical proficiency in POCUS by delivering rigorous assessments, providing educational resources and opportunities, and building global POCUS community. Now, before we dive deeper, I'm excited to share a short video that gives you a first look at our new lung POCUS course. As you watch, think about how lung ultrasound could impact your daily practice or help you grow your clinical skills. This video offers a glimpse of the interactive content and practical insights you will experience in the course.
Are you ready to take your point-of-care ultrasound skills to the next level? We're excited to introduce our brand new Lung POCUS course, designed specifically for busy healthcare professionals like you. In this lung course, you will learn everything about the basics of lung ultrasound, including anatomy, sonographic anatomy, and normal findings. You'll also learn how to identify lung zones, with discussions on important lung protocols and how they should be utilized in the clinical decision-making process. The course features numerous examples of actual cases, where you'll be able to see findings on ultrasound images and videos, as well as chest X-rays and CT scans. Don't miss this opportunity to advance your clinical expertise and deliver even better care for your patients. Register today and join a community of professionals committed to excellence in lung ultrasound.
Yeah, this is Vic here. So, lung focus is actually one of the most important focus skills to be learned, and it can apply that knowledge in almost every patient. Um, and we did a survey called POCUS 25, in which lung ultrasound was ranked #1 by POCUS users from around the world. And I'm excited because recently there was a study that came out which showed that X-rays and CT scan expose the patients to unnecessary high doses of radiation or ionizing energy, and that can lead to cancer development down the road. So ultrasound being non-ionizing, it's very safe for the patients. You can scan your patient at many times, you can monitor them. So it's really very exciting, the fact that you can make quick diagnosis or even diagnose new conditions or even use it for managing your patients. For instance, you manage patients with congestive heart failure, you can see the pattern changing on the lung ultrasound from B line to A line pattern. That means the fluid is being reduced in the lung parenchyma. So it's really, really exciting. And the good thing about lung ultrasound is easy to learn. So a lot of folks question about that is it going to be too difficult? No, it's not. It's one of the easiest skills to learn, and you have to learn to appreciate the different findings. And the lung course has lots of clinical ultrasound images and videos, as well as correlation with X-rays and ultrasound, and as well as CT scan. So you'll be able to have a well-rounded experience, and I think you'll be able to apply the knowledge immediately on your patients.
Thank you, Vic. Daria, can you tell us how these lung POCUS offerings came about and what needs they address?
Sure. Thank you, Tiff. Hello, everyone. Thank you so much for taking the time to come to our webinar today. Um, as you know, the Academy was focused on the assessment of the knowledge, skills, and abilities for the longest time. But in the recent years, we saw that clinicians are coming to us and asking for structured education, a quality education that we can share with them so they can build that knowledge before coming to us for the certification. So we took a step back, consulted with our committee members. We have an education committee that we manage, and figure out the lung ultrasound is very important in clinician life, especially after COVID-19 pandemic, and that can help address a lot of skills that are needed in your daily practice. So we chose the topic and build this didactic education that hopefully can serve that foundational knowledge for you to learn about a lung ultrasound, and then go and build your skills and come back to us for assessment, which Lori will tell you a little bit more.
Thank you, Daria. Lori, for those interested in getting started, can you explain how to begin with our fundamental certificate and why it is the essential first step?
Yeah, of course. Thank you. So the POCUS Fundamental Certificate is a prerequisite to all of our advanced clinical offerings. It's imperative because it gives you the basic knowledge and abilities for physics and instrumentation. So you'll experience 8 learning modules with knowledge checks throughout, and then a 35 multiple choice summative assessment at the end. And to see the look and feel of it, we'll give you more information at the end of it. I do want to point out that the cost is $125 in the US, but we do offer global pricing, and Tiff will give us more information at the end of this presentation where you can find out more information for that.
Thanks, Lori. Daria, what can participants expect from the Lung POCUS course itself?
Sure. First of all, it's online, so you can access the course at any time of your day, whatever you are. It's you will expect about six learning modules and quiz questions, and then at the end there will be 25 multiple choice summative assessment. You'll have 30 days to complete once you purchase and start. And you can, complete one module, come back to it tomorrow, as long as you do it within those 30 days. And of course, you'll need to complete the fundamentals course before you proceed with this specific clinical lung POCUS course. And then I wanted to give you a little bit glimpse of what you see on the screen. So once you purchase, you'll see, you'll read about the course and objectives. And then once you enter the course, on the left side, you'll see all of the topics that you'll learn in the course. And on the right upper corner, you can see a resource tab where you can find additional resources and references for the course, where you can, go to them and study them or read additionally to this course. But again, this is all online. It's narrated. You also have transcript if you want to read. And then there is speed button that you can, slow it down, speed it up, however you need. It's very flexible. So yeah, I think I'll pause here. So Lori can take this on.
Yeah. Back to you, Lori. Can you walk us through what's involved in the Lung POCUS certification program and who should consider pursuing it?
Yeah, so the POCUS Lung Certification Program is really for people who are looking for an all-encompassing POCUS journey, from education, learning, practice, and then testing your proficiency. So what's involved is you get that POCUS Lung course that Daria was explaining, and then there's also a procedure checklist, an OSCE list, if you will, where it guides you. We give a lot of resources within the certification program where it guides you with how to scan lung and what to do. And then also we have a virtual logbook. So you have to scan and capture 20 of your images and identify those images before you can move on to the POCUS lung certification, which will involve clinical case assessment and video submission and peer evaluation. This you do have it sounds like a lot. I understand that. So you do have 6 months to complete from the date that you start. And the POCUS fundamentals is also a prerequisite, but it'll pick up where you left off throughout the certification program, and just to get a look and feel of what you'll be encountering. So again, you'll be going into our learning management system. That's where all of our products are living, and this is what you'll see when you log in each time. So you'll see on the right side here with a red circle, those are the number of clinical case assessments. So they're just scenario assessments that really engulf you into the situation. And then we also have peer evaluation. So you need two peers that can complete a questionnaire to attest to your abilities. So we're really testing those knowledge, skills, and abilities. Yeah, that's okay. And then it's still me. So, and then how to apply. So it's pretty easy. You first need to create a POCUS account. And I know Tiff was going to send those links as well. So you create a POCUS account, which you'll get a POCUS number, and you'll log into our platform with either your POCUS number or your email address and password. And then from there, you'll click from your My POCUS portal into our learning management system. And from there on the apply page, you'll see all the different offerings that are available for you. And you'll complete some attestations as well as payment. And then you'll start right from there if you want, or you can wait a couple of days, whatever your schedule sees fit. But again, you will keep in mind the time to complete component for all the offerings.
Cool. Thanks, Lori. And thank you to all of our speakers for sharing their insights. If you would like to register, you can scan the QR codes on your screen, or you can visit us at pocus.org. Like they mentioned, we do offer global pricing to eligible countries. So you can email us at pocus@intellios.org to learn more about that. Let's move into the Q&A portion of the session. First question is for Vic. Vic, how can lung POCUS be integrated into daily clinical practice for respiratory assessment?
Yeah, as you know, every patient that we assess, most of them, we are assessing patients using traditional methods, using stethoscope, but then you can combine the ultrasound, and if we have just scan the different lung zones, and obviously the examination should be kind of tapered or catered towards the indication that we have. So if you have, for instance, a patient that we suspect may have congestive heart failure, then we're going to scan the different lung zones, look for the B lines, and count the number of B lines in that area. Or if it's a different condition, we're expecting pleural effusion or even a mass in the lung. So there are different ways of looking. So approach it in a holistic approach. So obviously you're going to do your physical examination, and then following that, we're going to use the lung ultrasound to assess your patient, and note the findings and document the images, and also compare with the other studies. So it doesn't mean that lung ultrasound is the only thing to do. If you feel that the X-ray is needed or a CT scan is needed, we definitely want to proceed with that. But at times you will notice that you'll get normal lung findings, A lines everywhere, normal lung sliding, no evidence of any pathology. Then you may want to reconsider. And that's the advantage of lung ultrasound, that you want to prevent unnecessary exposure to ionizing radiation, because as you know, ionizing radiation can lead to a malignancy after 10, 15 years or 20 years. So that's where this comes in.
Thank you,
Right.
Vic. We did have a question that came in the comments. I'm gonna pass this to Daria or Vic. The question is, I have practical experience from lectures and YouTube and self-teaching, but I want to learn in an academic way. From where should I continue? From basic or only do I, or from to exams and send video clips that I made during my practice? Daria?
I think you always, fundamentals is our prerequisite. So if you want to, start with Certification Academy and getting our certification, so you'll have to start with fundamentals, which is again online course that you'll do, and it's about 4 hours of your time. And then you can move to the long course and eventually towards certification. Through the certification program, you'll get additional resources, as Lori mentioned. So I think if you have experience, this can be definitely something more tangible as far as certification. And we can definitely support you along on your journey. But Vic, feel free to add on from your as clinically experienced, like what do you see as benefit getting the certification from us?
Yes, Laurie. So yeah, that's a great question. And I think everybody is naturally kind of thinking of that way, but I think having a more structured approach, and we have gone through every basic, because when we do online learning or attend lectures, sometimes certain topics are missed or taken for granted. And so it's going to definitely help you out to be able to go in a systematic manner. And then we have made sure that our content is 100% accurate. I've seen online, sometimes there's some inaccuracies. So I would call our course as the gold standard, coming from, Intellios and PCA. So we made sure that everything is accurate. And so if you read that and learn it the right way, but I'm sure there are lots of resources online, and those are also helpful. But it would definitely help to have a little bit more structured approach, and it goes step by step through all of these that you need to know. And I think you'll be a champion at the end of it. That's what I feel.
Yeah, and if I can add on, I think what differentiated us, it was built by clinicians for clinicians. We're truly global. So we take a lot of pride in how our education certification assessments are built. So an education is built to a certification standard that's been out there. So that's the biggest difference I feel like that we can offer. So yeah.
One last thing to add on that is that we do have a video submission process in which it's really designed to provide constructive criticism in case there is something wrong or some technique is wrong. So we'll go through all the steps and we'll provide you feedback. So it's really helpful. We're doing ultrasound, but maybe one thing is wrong, or maybe it's perfect. So if it's amazing, we're going to say excellent. But if you need some improvement, some areas, so keep that as a constructive feedback. Is designed to help you improve your scanning process. Thank you.
Thank you both, Vic and Daria. This question is for Lori. If I have an APCA POCUS certification in 2018 and an ARDMS MSK certification in 2014, do I need to get fundamental certificate before proceeding?
No. Quick answer, no. So our Intellios is our umbrella organization, and sitting under it is ARDMS and APCA, and then also the POCUS Certification Academy. And because of the components that are within, for example, your RMSK certification, you've completed certain physics and instrumentation questions. So that would automatically be waived if you enter your ACCA or ARDMS number when you create a POCUS ID. We have it set up so our systems will automatically waive the POCUS Fundamentals certificate. And can I just add, so the POCUS Fundamentals is also more, I would call it more of a course than a certificate, because there is a lot of learning within. And then also within our website, within our learning library, we also have a lot of resources available that you can use while you're in the process of that course.
Thank you, Lori. Vic, this one's for you. How much fluid is required for B lines to appear?
To be clinically significant, obviously, as you know, the pre-lines between the two intercostal spaces. As the amount of fluid increases, the number of B lines also increase. At some point, ideally, there should not be any B line. Let's be honest about that. But we consider one or two B lines to be kind of normal. It's really like a low normal, But ideally, if you look at a normal individual, scan yourself, you should not be seeing any B lines unless you're looking at the bases of the lungs. So once you have the number more than 3, is significant, and that's considered to be clinically significant. And then as the B lines increase, then they will become confluent, and they will all join together, and the whole area might become like white. And further down, you can even have a pleural effusion appear. So it depends on the progression, but there is not exactly like how much volume or that. But basically, main thing is as the amount of interstitial fluid increases, as the condition of the patient worsens, the number of B lines are going to increase. And once you treat the patient correctly and the patient is responding, then the B lines will reduce, and eventually the B line should disappear, and it should become A line pattern. That means no B line at all.
Thank you.
Thank you.
This sort of aligns with what you just another question that came in. How can you differentiate B lines from consolidation versus pull edema?
So again, how can
How can you
differentiate?
differentiate B lines from consolidation versus pull edema?
Yep. So the B lines, that's what I'm saying. The lung ultrasound is more or less, you have to combine it with the clinical picture. So it's very important to take the history for examination and look at everything, look at the heart, and then look at the lungs. And then bilaterally, if you see, there's going to be more for like congestive heart failure appearance. And so that's really what it is. So you have to put it in the clinical context. And consolidation is very different. It's going to become more like a hepatization of the lung tissue, and we may even start being able to see, since the air is more or less gone, there will be some air inside, so we see air bronchograms in there. If the air is kind of moving during the bronchioles, then you will see, the air bubbles kind of moving back and forth in there. So it all depends on the clinical picture. So that's what I'm saying. Put it all together. Don't just look at the lung ultrasound and then decide. But some of these findings are actually like a dynamic air bronchogram. Those are very much suggestive of consolidation.
Thank you, Vic. Daria?
Yeah, and just wanted to add on, there's a lot of these type of scenarios that are covered in the course, and the course takes you step by step on how to recognize some of these pathologies and understanding all of the sonographic findings. So I would highly recommend, enrolling into this course, and it will, like all of these questions I love. Vic is our excellent clinical expert, but you can have it at your fingertips, with this course that we built. And Vic was heavily involved in writing content, so I would highly encourage you to check it out as well. So yeah, just wanted to add it.
In ultrasound, if I may add, ultrasound, we have something called pattern recognition. All these conditions have a very specific pattern, some of them at least. And you may just be put the probe in the patient, and within seconds you have the diagnosis. And you could, without the lung ultrasound, you could spend entire days, and still not be able. I remember when I was working in mission hospitals, sometimes we didn't have access to ultrasound that time, and the patient, we're trying to figure out what's wrong with that patient. And eventually, one patient I remember, unfortunately, even died because we could not recognize the fact that the patient actually had a COPD exacerbation, and we were treating the patient as CHF. So those sorts of things will be totally avoided. You'll get a much more clearer clinical picture of the patient. And so it's a win-win for everyone, I guess.
Thank you, Vic. This one is for Daria or Lori, or any of the panel can take this. Between the two training courses, so the courses that we just presented, Which would you recommend for someone working in an intensive care unit? And is the certificate internationally recognized?
Yeah, I guess maybe I'll start, Laura, if you're okay. The POCUS Long course is just an educational component, didactic education. But if you would like to pursue the entire POCUS journey with education and certification in one package, the certification program will be the better choice. That way, you're not only learning about POCUS Long, but also validating your knowledge and skills and abilities. And the program is taking you onto the entire journey. So I think, per our mission and vision, we see that certification is an important component of someone's proficiency. So I would definitely encourage everyone to go through the entire program. But Lori, feel free to add on.
Yeah, I would say the same. And I would add to it that it's the full journey. And in terms of, is this internationally recognized? So we do, as Daria mentioned, we developed this course and the certification program with global subject matter experts, so from around the world, to not only write and review, but everywhere. So it's developed with rigor that can really be defensible to the world. We don't have global accreditation just yet, but it is developed with a professionals who are dedicated to the highest standards in healthcare. My recommendation would be to go for the lung certification program, or we also do have a critical care specialty certification that's available too.
But we are going to conclude today's session, and we thank everyone for joining us. I'm going to put the slide up with the QR codes again in case you need it to register, also so that you have our website address, pocus.org. You can email us at any time and a staff member will get back to you, pocus@intelios.org. And we thank you again for attending today's session. We look forward to supporting you on your lung POCUS journey, and we hope you have a great day. Thank you.